All right, welcome back, everybody. It's our final session of today, and we have Alicia Sanziani, and I'm hoping I'm pronouncing that last name right. You can correct me if I'm wrong. So happy to have her presenting this last session. She is a navigator, and she will be sharing the stage with consumers just to hear their perspectives and what they can offer to help us in better assisting consumers in this work. So with that, I'm happy to hand the stage over.
Thank you, Allison. I appreciate that. And I am really excited to be here. I want to say thank you to Covering Wisconsin too, and all of the sponsors for another awesome conference. The presenters provided a lot of new resources. Even though I've been doing this 10 years, I still learned a lot of new things. So again, my name is Alicia Canziani. I am a benefits navigator, and I've been with the Family Health Center for many years. I work with a great group of people, which includes 3 navigators, 2 of which we had presenting already. And our community health center is based in the Marshfield area. However, we do have 10 dental centers. As navigators, we are looking at numerous options for households and folks. Like Vanessa said, all of them are based on household size and income. So we do a lot of work. A lot of it is still done remotely. When the initial conversation comes in, usually it's a referral, maybe it's a phone call, it's a friend of a friend. And I like to do a meet and greet virtually. At that time, I do some info gathering, kind of collect the pieces of the puzzle, if you will, so that I can put together a pretty picture. To do so, it's imperative that we navigators build that rapport and trust with our consumers or patients, as I call them. And sometimes we're exploring things like CHIP, the Children's Health Insurance Program. Maybe we're looking at Medicaid. In a big part of the day, I'll be working with healthcare.gov or Marketplace. And I just like to always put out there that I caution people when we say Marketplace. I know a lot of people are on Facebook. Let's not ever purchase insurance on Facebook. The healthcare.gov.org is the marketplace that I'm referring to. And when it comes to those plans, we have a plethora of options, especially in the Northwestern region when I get over towards Eau Claire and Chippewa counties, sometimes over 50 different options. It is necessary to narrow that down based on the consumers' needs and their budgets, and really get them set up with something that they will not just enroll in, but that they will actually utilize. So again, I'm excited today to be here presenting with our panel of consumers that are going to talk about their lived experiences. And we are going to touch on some of the things pre and post the pandemic. First, we have Andy from Pierce County. Andy and his growing family came to me and we started working together virtually a couple years ago. He's right at the edge of the state, and going through his situation and finding coverage for him turned out to be a little bit more challenging. We have the kiddos with one insurance, we have mom and dad with another, and mom transitioning even once again. So we have Andy. Next from there, we have Jake. Jake is a young man from Marathon County. He came to me a couple of years ago too, and we heard from Bill yesterday, the Medicaid director for the state. He talked about Medicaid could not be terminated during the pandemic, that people could not lose insurance or go uninsured. And Andy is an example of that situation. Everybody's got their own unique situation, and they're going to share those experiences and kind of paint a picture for us today. If you do have questions, don't be afraid to put them in the chat. We next have Jan. Jan comes to us from Eau Claire County, retired teacher after 31 years. Thank you for that service. And last but not least, we have a couple also from Eau Claire County, and they have worked with me forever. They were with me pre-COVID. We met in person, and then we had to switch to working virtually because of the pandemic. So this is our panel, some wonderful people, and I have the pleasure and privilege of working with them, and we're going to dive into some Q&As now. So Andy, you're up first. Again, we began working together a few years ago. He was transitioning from employer coverage with Cobra and was referred to me. Andy, my first question for you was, prior to reaching out to me, to contacting me, how knowledgeable were you with the different insurance options out there, like Medicaid or CHIP for the kiddos and healthcare.gov versus employer coverage?
Yeah, well, good morning, Alicia. Thanks for having us on. Happy to share my story. Not very knowledgeable. I had been with my employer for about 13 years, and they offered great healthcare benefits, so I never had to really search on my own. And as you probably remember, I had kind of dabbled in healthcare.gov a little bit, set up a profile, and probably made your job harder by trying to do it on my own. But I couldn't really figure it out. And there's a lot of different options. It's very complex. And so, as you know, a friend of ours recommended you to us, and I'm so glad I reached out and had you as a navigator, because I didn't understand it. I needed to find coverage for my family after our Cobra ran out. And the way I was doing it was going to be very expensive. I didn't know about a lot of the resources that you were able to point us to. So to answer your question, not knowledgeable, and glad to have you with us.
Oh, thank you. It was really impressive how far you managed to get with creating your access or creating your account and application on healthcare.gov. So I applaud you for that. And as far as making the job more difficult, no, actually, I think if anybody is looking for a navigator, I would recommend Andy joining our team, really. And the second question I have for you was, what were some of the challenges that you faced? If you want to just touch lightly on the Cobra extensions, some of the things that were going on there, because initially we thought we were going to be setting you up close to 2 years ago, and then it didn't happen. Do you want to talk about that a little bit?
Yeah, so I think when I originally reached out, there was an error on Cobra's end where my premiums were more than doubling all of a sudden, and I thought, well, I can't afford this. I don't have that good paying job anymore, and my family was in a little bit of a financial bind. And again, I didn't really know where to turn, and started trying to do some things on my own. I didn't get very far. I can't imagine if I had kept going on my own how I would have ended up, but with our family situation, a lot of financial changes, and not necessarily for the better back then. And Alicia was able to help us point, obviously get our kids enrolled in CHIP, and then my wife was pregnant. She got enrolled in the Medicaid Badger Care as well, which was so helpful. Our first child was born premature, and we know what that NICU bill was. And that was heavy on my mind when we were thinking about our third child. What if that happened again? And what if we didn't have great insurance to help us cover that like we did for Winnie, our first child? So definitely getting enrolled in that program, which I don't know if I would have ever known about it had it not been for Alicia. Certainly helped our family out when we were in some tough financial times. And the kids are currently on CHIP, and they will be now for the next well, at least the next few months. So that's been great. And even though it's temporary, through Alicia, we were also able to gain access to some other resources. My family enrolled in WIC and Food Share temporarily, just as we get through this tough time. And again, the connection through Alicia and the consortium, just being able to have those resources available, things that I, again, probably wouldn't have known otherwise, has really been a big blessing to my family. I'm not sure how we would have navigated through all of this without our navigator. So, and we're coming out in a better spot here. But it's, again, my full-time job now, I work in the nonprofit world, and I know a lot of families, you don't always expect some things that happen, right? And all of us that, we're living a great life with a good paying job, and all of a sudden things change outside of our control. And it's great to have people and resources there to help bridge that gap and help us when we're in some tough times. So thank you again. Hopefully I answered your question.
Yes, that was perfect. Thank you. And thank you for the kind words. It's just been a joy working with so many wonderful people. And again, I call everyone patients and sometimes friends, because we do get to know each other very well. And with that, I'm going to pivot now to Jake for a couple of questions. Jake, he's an amazing young man, a med student who is a MMA fighter, and ironically was injured during one of his, for lack of a better word, one of his fights or matches, I guess probably is the best word. I'll let Jake speak to that more, but he had a serious injury and was really needing help. And Jake was very, like Andy, he went ahead. Becoming a young man, he decided at 19 he needed to create his healthcare.gov application because he thought he wouldn't have Medicaid anymore. And as we talked about before, during COVID, they wouldn't end his Medicaid, and he didn't even realize that he had dual coverage. Yet here he is, medical student, go-getter, trying to do it all. And do you want to just talk about how we were introduced and some of the things that we endured, and tell us a little bit about that MMA too?
Yeah, definitely. So I met Alicia from, I was at a jiu-jitsu class, and the person that I was sparring with took a wrong turn and landed on my foot. So I ended up with a Lis Franck injury, which ended up snapping one of the main tendons in my foot. And I also fractured some of the bones in my foot. So I needed to get reconstructive surgery. And then a few months following that, I needed to have another surgery to get those, I think it was 6 pins taken out of my foot. So I was definitely in need of some health insurance and getting that all sorted out. So I am originally from southern Wisconsin, but I moved to central Wisconsin to pursue my nursing degree, which I just received in May. And the insurance that I was on in southern Wisconsin did not reach up to central Wisconsin. So I needed to find a new one. But at the time that I moved up here, because of COVID, I had the Badger Care while I was up here, but I was under the impression that it would end at a certain point in time, but I was incorrect in that assumption. So I went on to Marketplace and I selected an HMO that I was with for roughly 7 months, and I was making payments for that. But as I was going in for appointments for my foot and getting checkups and the surgeries and everything, I was receiving bills, which I shouldn't have been receiving since it should have been covered under Badger Care. And lo and behold, it was a mix up with the hospital where some bills would get sent to the HMO and some bills would get sent to Badger Care. So it was a little bit far and few between for what I knew what was going on and what bills I knew I had to pay or what I didn't have to pay. So that was when I contacted Alicia, and we got in touch and figured out that I was under dual coverage. And throughout that whole process, we probably spent at least over 10 hours on the phone together, speaking with the HMO and going through the whole rigmarole of going through call centers and people in the call centers that didn't speak English very well. So it was hard to communicate with them and get across what we were trying to ask and get the information that we needed. And we probably, on one call, we probably spent about 4 hours together and got transferred to 5-6 different people to talk to. So it was a big whole process to go through, but in the end, we did get it sorted out. And once the Badger care for COVID was ended, I was able to get onto the correct insurance for where I was going for care for my foot, and we got everything all sorted out.
Yes, and I just want to reiterate that Jake was trying to do this all on his own and still going to school while healing and having some pretty intensive treatments. And I was just glad that we could work together, that we could, it was like peeling back the layers of an onion.
Uh-oh, we seem to have lost your audio, Alicia.
Can you hear me now?
Yes.
Okay. I was debating on my headset, but I'm gonna go with this. If you guys can hear me okay now.
Sounds great.
Thank you. So what I was saying is that with Jake, it was like peeling back an onion. We had layer upon layer, and every time we would learn something new, that would take us down another path. And at the end of it all, Jake, it was so great to work with you. Are you feeling all healed and you're doing good?
Yes, definitely. I have fully recovered. I'm working now again, and I don't have any restrictions anymore.
Wonderful. Good to hear. And with all of that, I'm wondering, are we ready to do one of our poll questions, or shall I move to Jan?
Yeah, we can do a poll question. That works. So let's see. Let me bring that up. And that has been started. So the question, I'll read it. What was the first coverage year for the Affordable Care Act, also known as Obamacare or Marketplace, also known, I would say, as healthcare.gov? And so people are responding to that. We'll give it maybe another, we'll give it a little bit more time. So the answers that are the options, I will say, that are possible. So there's 1999. There is 2014, there is 2020, and then there's 2018. So people are putting in their answers. A few more still trickling in. Give people a second to ponder that. And it looks like it's slowed down, so I will end that. And so most people said 2014, 79%. And then second closest answer in terms of number of people responding was 17% said 2018, with 2% on 1999 and 2% on 2020. So Alicia, you want to share your response to that?
Yes. So the Affordable Care Act was in progress many years before coverage actually began, but the year that coverage was available was 2014. All right. I apologize for all the noise. I am at the dental center today, and there's a lot of little ones who don't really want to go to the dentist. So sorry. Now we're going to talk to Jan. Jan is a rock star. She taught for many years and comes to us again from Eau Claire County. She had a few things going on and decided that it was time to retire early. So, Jan, do you want to talk a little bit about how we met and share some of your knowledge?
Yeah. Good morning. I retired in 2020. Of course, that was right in the midst of the pandemic, and I wasn't planning on retiring, but I have an elderly mom who lives on the other side of the state, and I had been going back and forth during the summer, spending time with her, being with her, and then coming back here, then going back there. And I'm like, this, if I go teach, I'm not going to be able to see her for the holidays because I'd feel like I have to quarantine because I'd be the hybrid teaching students. And I'm like, no. So I did my due diligence and I found that I could retire because I did receive an email telling me that I was able to and they would not punish me for retiring before the school year started. So I made the decision to retire so that I was able to go back and forth and spend time with my mom, help her when she needed help, that sort of thing. So again, wasn't planning on it, but the situation, the pandemic came up, and in the midst of trying to figure out what I was going to do, someone gave me Elisa's name and number, and I contacted her. And at the time, that first year, I still took the school district insurance, but then things got dicey from there. And do you want me to talk about that yet, or do you want me to wait for the question two?
I think that is great. Thank you for sharing. And let's go to question 2. So some of us know what a HRA is, health reimbursement arrangement. And most of the time, I would say probably in my work, 95% of the time, it's not a factor. It's not something that is there. But for Jan, it turned out that she did have a HRA, and it was a healthy HRA, and we had to go through some extra steps and take extra measures to see if you could receive the premium tax credits on Marketplace or not. So yes, if you want to do a deeper dive on how that all worked out.
Yeah, the year after, so it'll be in my second year of retirement, the district that I worked in hiked up our insurance by 70%. And so to get us, they wanted us off off the school district insurance. And so that really forced me to go out and look. But when I retired, because of when I started, I received a healthy stipend upon retirement. And so what we found out was that because I had this stipend, I had to make a decision to either use that stipend or not use the stipend and go with credits. But if I remember correctly, if I went with the credits, I couldn't go back to the stipend. Was that correct, Alicia? Yeah. So I made the decision that I was going to stick with using my stipend, but we sifted through, I don't know how many different options for insurance until we found one that worked the best for me at the time and still works. I mean, we still do that. What I appreciate the fact is that through this whole process, Alicia is looking out for me, and she gives me options. We talk about those options, and we try to figure out what, because I have to, how you're going to replace your knees this year, you're going to wait. And so that all plays into what insurance you're going to pick. And so, yeah, so I really appreciate the effort that she puts into helping select the best option for me on that given year.
It's a pleasure to work with you. Absolutely a joy. And she's a go-getter. So even though she retired, she's still subbing. She's got not one, but 2 part-time sort of self-employment gigs, and just an incredible person. And my next household is a household of 2. So we've got one of the coolest couples I've worked with today, and they're coming from Eau Claire County as well. We have Jean and her husband, Rich. And we met, like I said earlier, at the technical college, which is in Eau Claire. It was CVTC. They came to an open session and had quite the story. And when we met, again, like with Jake and some of my other consumers and patients, there was a lot happening. There was some layers that I had to peel back the onion and couldn't change what happened in the past, but decided that we were a good match and we were going to work together moving forward. And is it 8 years later now?
Yep. 2016,
Yeah.
we started.
And sadly, they left me because they went to Medicare. So while I am licensed with the programs here at Family Health Center, and then I'm licensed with the state Medicaid CHIP programs, licensed with the federal healthcare.gov. I am not licensed with Medicare. So, Jean, if you could please tell the audience today why you came to that session and what was going on.
Well, when we, prior to meeting Alicia, we were on Marketplace, but we were not very familiar with how the program worked. And then, ended up having to pay back money. So, and then the people that we were working with no longer offered services. And then we seen that this session was going to happen at the CVTC. So we went to that. And from then on, it's been wonderful. She said she would never let it happen again. She would do what it, help with, work with us.
Yes, and it's all been good. It's kind of funny because sometimes I ask so many questions and I feel like a detective. It's not that I want to harp on people or, be too intrusive. It's just that when you reconcile your taxes, there is that check and balance that you receive the right amount of assistance and you don't have to pay it back. Because otherwise, what was the point of getting on and getting that help, right?
Exactly.
So, with that, Rich, it's a good lead into talk about your life changes and the reporting of changes. I feel like we talk, which we're not anymore, sadly, but we would talk a couple times a year, right?
Oh, yeah. Yeah, because it's real important, because getting to that point of at the end of the year when the taxes come due, that's when everything has to be in line. And if you don't report changes or whatever, I mean, it just creates, like we had before we started doing that. I had worked retail for how many years, and of course retail has changed quite a bit. So then the places close, or you're no longer employed and you still got bills coming in, so you got to work and you got to get insurance, and it's been constant. And your income changes, and if you get a raise, or if you get you get cut back in hours, or like with COVID where we got cut back quite a bit, and so you had to report those changes so that everybody was in step with knowing exactly where you were, project what you're going to do, and with those projections come adjustments. And we'd look at it every quarter, and keep track of it, is because, like I say, we got burned once and we weren't going to get burned again. So, but that was the main thing of reporting the changes, is it keeps them informed and it keeps us informed of, we know where we're at, what stage we're at, and, you can adjust for that. So.
Yes, thank you. And I hope that everyone who works, whether it's with an agent or a navigator, I hope that they have that relationship where you're just a phone call or an email away to stay on the same page, so that those reconciliations at tax time balance out. If that is the one takeaway that I would recommend, is that everyone stay in touch. And I'm going to circle back to Andy now. I had another question for you. I don't think that people hear enough about navigators. There's not enough knowledge out there. Almost every one of you came to me through another resource or person that I had helped in the past. So, what do you think, if anything, we can do to better promote our services, and especially over on our northwestern part of the state? So, we know Milwaukee's covered, we know Madison, Green Bay, those bigger metro areas, there's a lot of marketing. What would you suggest we do differently over in our rural communities?
Well, word of mouth is always the best, as you said, and it's funny, even going through this. I was telling my wife, I wonder how many people at her work, they have really high cost healthcare that we determined. Her employer determines whatever, that it's not affordable for an entire family to be on their plan. It's only affordable for the employee themselves. But how many other families at her clinic could benefit from having a navigator, somebody that could help their family, maybe cut some cost or make sure that they're taking advantage of many of the opportunities that are out there that they just didn't know about. And so I think word of mouth is important. I don't know if employers would help promote the use of a navigator, especially those employers that don't offer full family affordable care. Just to say, we know we don't offer this, but here's another option. You can reach out to a navigator and they can help you explore all the different possibilities that are out there.
Nice, thank you. And Jake, what about you with your experience? And now that you're going to be in the medical field, what do you talk about with your family and friends and future patients? Are you comfortable talking about the importance of insurance and navigators? Do you have any suggestions for us?
Yeah, I definitely feel a lot more comfortable with, I guess, just insurance as a whole and marketplace altogether, where it was actually kind of funny because right after me and Alicia got all of my situations sorted out, I was able to take that knowledge and I was able to help one of my friends that was back in southern Wisconsin get onto marketplace and get some insurance for him since he had a kid on the way. So I was able to take my knowledge from Alicia that she bestowed upon me and give it to my good friend back home. But I definitely agree with Andy that just being able to get that information out there, that there is navigators available, because at least at the start of my situation, I didn't know that there was navigators available to help me. So that's partially why I took it upon myself to try and figure it out, and like calling my parents, asking them questions and everything. But you can only learn so much from, like, at least in my case, my parents, because they've been doing it for however long, but they've only had their situations, where my situation was kind of specific due to COVID. But I definitely agree that getting that information out there, that you can call someone and there is someone available to help you instead of just trying to figure it out yourself.
That's well said. Thank you so much. And I'm glad that you shared that about your friend. Kudos to you. Wow. And congrats to him and his little one. So, Jan, I want to follow up with one of our navigators yesterday was a presenter, and she talked about the Sacred Heart Hospital and St. Joseph closing in the Eau Claire and Chippewa area.
Yep.
And you being in that community, are you, as a patient, being affected by that? Do you have family and friends that are struggling? What's going on over there?
Well, thank you. Lucky for me, it wasn't my hospital that I go to with my insurance that closed. However, I do have well, not family, because I don't have family over here, but I do have friends that are definitely affected. And whether it's losing their job because of the closings from those two hospitals, it's really tough. I mean, we lost the only mental health facility floor or area in this area. And so now there's no help for those that might need mental health help. And, and that's really a very tragic situation that, that we have going on here. I also think that, there's in all these people, we now have to find different doctors and physicians to go to, and everybody's booked. So getting into someone is really tough. And so I think that's also going to play into a lot of people's. I mean, people have to leave and go to Marshfield just for appointments. Whether it's because, the cancer situation or whether it's just regular appointments, because there's nobody in here. You can't get in anywhere. And so it's a huge, I think it's a huge issue. And I'm hopefully that I know there's a consortium that there's looking at trying to do something. So hopefully some things get worked out. Grateful for me, I guess I still have my hospital, but other people they don't have that. And that's 2 major hospitals in, 2 communities that are right next to each other. That's a lot of unemployed people. That's a lot of people looking for new jobs. That's a lot of people that are looking for new physicians to go to. So that's not easy for either community and these people.
No, and I'm glad that Sue and her team were able to do some rapid response sessions where we were boots on the ground. We were meeting with people. We would sit at the hospitals, the clinics, libraries, you name it, and try to reach out to them and explore those options. And as a patient myself in the Chippewa Valley, that did affect me and I did have to transition. So thankfully it's all going well. But yeah, there's a lot going on in the world right now, and I'm glad that your clinic is still there and you're not feeling too much of it. Allison, I didn't know, did we need to do another poll question?
We certainly can. Let's see. So the next poll question has started. Which of the following life changes must be reported in a timely manner? So we have 4 options that you can select from. 1 is income. 2 is a move. 3 is both. And the 4th option is none. So we'll give that some more time for people to choose among those options. So again, which of the following life changes must be reported in a timely manner? And it looks like most people have responded, so I'll go ahead and end that, share those results. And 95% said both. Just 2% said income, another 2% said move, and then 0% said none. So what is your response, Alicia?
Can you read it again? I don't have it up in front of me.
Yeah, so it says, which of the following life changes must be reported in a timely manner? And so there were options for income, move, both, so both income and move, or none. And most people, 95% said both.
Correct, yes. That was kind of a trick one. I wanted to make sure people have been paying attention the last few days. Thank you, Allison. I am going to now just address some of the Q&A in our inbox. One says, congrats to Jacob on his nursing degree. There was also a question about how did you have dual coverage? Well, like he had mentioned earlier, it sounds like she might have missed part of this conversation, but he had moved and believed his Medicaid had ended, but because of the pandemic, it could not be terminated, and he had his marketplace also. So we ended up actually terminating the marketplace, filing an appeal to have it backdated. It took months for the claims to get resolved, but thankfully, through faith and perseverance, we were able to get the job done, and now he's doing great. There's a couple of comments about it being a great session, showing all the complexities and the value of working with a navigator. So thank you. There's one about CHIP. So the question reads, wouldn't kids qualify for continuous coverage through Medicaid CHIP regardless of income fluctuations? Regardless of what insurance you have other than employer, you need to be reporting those changes, and your children could potentially be no longer eligible. So lots of nuances there, and my recommendation is to always report those changes. I want to circle back to Jean and Rich. So as I had stated earlier, sadly, they left me and went to Medicare. Jean, you left first. They both turned 65 in the same year within a short amount of time. Can you speak to what that was like, having that transition, getting the knowledge of Medicare, the different programs and supplements, and how that worked with terminating the marketplace for you?
Yeah, it was, well, we had reached out to you and you had said somebody we should go see, and we set up an appointment with her, and she was amazing also. She explained all the difference between supplemental plans and advantage plans and what was best for us. And as far as switching over, I had no problems with it. We canceled my marketplace, and the day that my Medicare took effect, and I haven't had a problem with it since.
Yeah, that was December last year. And then I just turned 65 in August of this year. So we're just getting, and there's a few snafus yet. We're trying to, with the marketplace, trying to get they keep sending me that I got to reapply for marketplace. That's not the case because I've canceled it on the 31st of July, which we've done. And it's a matter of just getting that taken care of, but everything else is in place. It's just, that's the only difference. Because like I say, hers was last year and it was December. So it was just basically starting the new year, where I'm in that middle of the year. So it creates another layer of, you got to get the first 6 months or first 8 months out onto marketplace, and the other two, and the rest of the year will be on Medicare. So.
Well said. Yes, thank you. And thank you for the reminder too about the fact that healthcare.gov, Marketplace, Medicaid, they send a lot of mail, a lot of letters. And I feel terrible because we're truly taking down forests with what they're mailing nowadays. But a lot of times people receive something, they're not entirely sure what it means. Sometimes the verbiage is a little difficult to understand, and always feel free to reach out to a navigator, to Covering Wisconsin, to your agents. It's important to follow up on those things. Please never just disregard them. And then there was another question I wanted to talk about. It says, Andy mentioned the employer coverage and the insurance affordability. So that gets very deep, but what I will say is, if someone is offered employer coverage, there is an affordability calculation that must be done to determine whether or not they are truly eligible for assistance with healthcare.gov, or if they have to accept their employer coverage. You can't have both. It's kind of like when you're shopping and you've got two awesome coupons. They say, oh, you can only use one. So you either are taking the employer coverage or you're taking the premium tax credits. That affordability calculation changes every year. I'll be sure to add that that calculation tool or employer tool into the presentation when that gets sent out. So Allison, if you can help me with that, please. And then there was another question. Oops, I lost it. I apologize. I'm not as tech savvy as I thought with these questions. Okay. All right. I think I got them all. I do want to thank everybody for being here today. Your time, your experiences, your input is valuable for new navigators, for existing navigators, for the agents. It's important to really have a understanding of what this looks like, and nobody can speak to it like our patients or consumer panel. So I appreciate you for doing that and being here. The other question did just resurface. It says, I thought that Marketplace and Medicaid talk to each other. That's a great concept. In reality, there is a huge hole. It's a gaping hole. And when someone is transitioning from Medicaid to Marketplace, there is a breakdown in communication. If someone is transitioning from Marketplace to Medicare, they say that they'll automatically term that Marketplace. And I literally read that in the attestations numerous times. However, I take that extra step. I call, I make sure if I'm able to see their insurance through the insurance portals, I will watch to make sure that that termination date coincides and is correct for what we need it to be. So I know they say that they're talking to each other, but that's all the electronic version. I think that there still needs that human touch, that interaction with people and conversations, especially when we create an application on healthcare.gov and it looks like somebody is eligible for Medicaid. It may kick them right over to their state. And then the state says, oh, wait, you're really not. And so there's this big domino effect and sometimes a landslide that happens, and then people end up being uninsured for a period of time. So again, I can't stress enough, just reach out if there is questions. I am looking to see if there's any other questions. I think I've got them all. I want to do a couple of last questions here, and Andy, I don't think that you knew this one was coming, but with your healthcare.gov creating the account and Jake with yours and everyone else in the audience, have you noticed the change in the application and where it's adding extra layers of security? If not, I would like to talk a little bit about that right now. So what's happening is they initially ask you when you create the account to verify your identity, go through all of those things. We do our HIPAA privacy notices, etc. But now, because there has been an influx of cybersecurity attacks, the bad actor agent scams, now on healthcare.gov, it says, do you want to add your, I can't think of the exact wording right now, I apologize. Do you want to receive a text message for extra layer of security and validation or verification? Julia could speak in, I would love it. She probably knows it word for word. I am encouraging everyone now to do that. It's unfortunate that a lot of people have had their identities compromised, and there have been people who have been acting like they're navigators and they're agents, and they're changing people's insurance programs and policies so that they can make commissions. By adding this extra layer of security, it sends a text message to you or can call you or maybe an email. I don't recall, but I would advise everyone to take those extra steps now and just to be extra safe. Any input, any thoughts any of you have experienced this yet?
I'll just say, I had to call an update when we were looking at my wife's insurance options a couple weeks ago, and I always opt to call. Again, there's so many of those nuances. Not that they always want to answer all your questions, but you can't really ask questions to an online form. So I always find it more impactful to call, and they certainly aren't asking for, they ask for the identifiers over the phone, but I haven't seen any of that online. And just really quick to touch base, I saw in the Q&A questions about the chip. I know I talked to the consortia a few weeks ago just to confirm some things. If our income goes up, which it will be going up here over the next few months, we won't lose coverage for the kids necessarily unless we win the lottery. But what would change is right now we don't have to pay a premium for the kids' insurance. If we make over a certain amount, we might have to start paying a monthly premium for the Badger Care chip. So that's really why they want that income update, just to add to the premium cost. But we shouldn't lose the coverage, as some people have noted. It's just we might need to pay some more of the premium. So hopefully that answers your question. And second, with my wife's employer, using that employer affordability tool or whatever that was called that Alicia sent me, my light bulb moment was how many of the other families that maybe don't make a ton of money that work at that clinic just think that they have to the whole family has to take coverage from that employer, even though the employer says we don't offer affordable family coverage. And could other families benefit like ours and say, okay, well, my wife will be on the employer plan, but the employer says they don't have affordable care for the whole family. So the rest of us can explore other options such as the marketplace and get the premium tax credit because we don't have employer affordable coverage for the entire family. So hopefully that answers that question. So.
Look at you. You're a rock star on the questions too. I love it. All right. I thought I saw one more pop in there. We're coming down to the last 8 minutes here. Jan, Jean, Rich, Jake, Andy, I thank you all so much for your time today. Do you have any other recommendations on what we could do to improve our services?
I just want to say that we are so fortunate to have you as a navigator. Rich and I are not tech savvy people. So every time we did phone calls or whatever, you did all the finger work for us and everything. And we really appreciate all the help you gave us.
And following up with what Jean said, I have to say I'm not a numbers person. And with the district, I just got insurance. I just dealt with it that way. I didn't have to do anything. And then once I had to leave that insurance, someone like you to help me navigate, because numbers, I glaze over when and you know this, when you start talking, how much does it cost versus what is my deductible? And my eyes just go, and so, yeah. So I truly appreciate the care that you give to us and the time that you give to us, helping us figure out what's best for us.
Oh, I'm speechless. You know me, I'm a sensitive girl, and I appreciate the kind words. This was about you guys today. It was about what we can teach our navigators and agents out there. So thank you. That means a lot to me.
I'd say no improvements. I'd say no improvements in the services, Alicia. It was amazing. Like I said, I don't know what we would have done without your help. I just think, I work with grants at my job now. It'd be great to see if you guys would qualify for like a grant to just get the word out there some more to the community as far as all the great services you offer. And I think we're inundated with scams and people that want your money these days. Like this isn't obviously a scam. This was so helpful. And, I think to really, shine as an example of these are people that really want to help you, can help you. There's no cost associated with it. It's just really to help you navigate the crazy landscape that is health insurance. Whether that's in senior living homes or it's in employers' handbooks, whatever it might be. I think there's many ways to get the word out there, so more families and individuals can benefit like those on the call today. So thank you.
Well, there's also, there's those monthly magazines that you can pick up, like Senior Living, Volume 1. It would be nice. I mean, maybe that's a place where you start getting that information out there, and so that people know that a navigator doesn't work for insurance companies. And I think that's the key, is to let people know that you guys don't work for insurance companies. You guys work for us. And that's, I think, is key to understand too.
I love that. I actually wrote it down, and I will do more to spread the love and spread the word. And I agree 100%. That is well said. We are here for you, and our services are free, and we want to continue to help people. I remember when I was asked at Chippewa County, where I started working under a grant, if I would do this healthcare.gov, because as a former educator and I had dabbled in the medical field, that they thought I would be the perfect one to educate and enroll people. And I really jumped on, and I got behind that because I remember the need of insurance from beginning of life to end of life. And it is so complicated, and we want to bring it to an understandable level and help as many as we can. And thankfully for Covering Wisconsin and all the sponsors, we can do that. And I am truly grateful that you guys could be here today. I had a couple other ones that for a variety of reasons couldn't join us today, and I'm sorry that they were not able to, but truly thankful for all of you and our people behind the scenes doing audio visual and all the things that we need. I did see one other question. It's asking Jan about the HRA. Yes, in her situation, it is used to cover her full premium. So even though that premium's a little hefty, she has that HRA covering it all. Yes. Well, thanks again. I wish everyone a wonderful day and appreciate your time.
Thank you so much, panelists. Yes, couldn't agree more. What a wonderful way to round out our morning and our second day. Always really helpful and instructive just to hear from consumers about the experience and to remind everybody of why they're doing this work. Lots of really great comments in the Q&A. William did help to provide the clarification that, continuous coverage for kids in Badger Care is now requirement. So definitely reporting income changes, that kind of thing is still expected, but continuous eligibility is for kids is now in place. So that's a great reminder. Thank you, William. If there are other questions in the Q&A that didn't get addressed, as with the other sessions, we will share that back with the moderator and panelists to see if we can get some more of those answered. And if we can, we'll post those on the website next to the recording and the PowerPoints as well. So we'll see you all again tomorrow morning for our last two sessions, and super excited to have those presenters, really good topics as we have seen. And so thank you for your time and have a great rest of your day.